Hi, I'm Dr. Salman Haider. I'm a consultant neurologist. My NHS practice is based at Queen Square, one of the world's leading neurological hospitals. I'm bringing my acute skills to private centres, including at the Princess Grace, at Queen Square private consulting rooms. And today, in fact, I'd like to talk to you probably about one of the most common conditions I see, which is migraine. Often patients present with headache, and when they come with headache, one of the things that they're most worried about are things like stroke, brain tumor, multiple sclerosis, something catastrophic. Usually, once they see somebody like me, they get sorted out quickly, they get the reassurance, they get the scan. Actually, it usually turns out to be something like migraine, which is far more benign than the conditions that I've described, but is nonetheless disabling, which is why patients are coming to hospital or seeking attention for it. So let me tell you a bit more about migraine. Migraine's a very common disorder. It's one of the most commonest headache disorders. I myself, in fact, suffer with migraine, so I know to some extent what I'm talking about when I say it's disabling. It is one of the simplest ways of understanding it is that is the brain's way of telling the body, I don't like what you're doing to me. Another way of understanding it is this sense or the word that you may have heard in the public about overtraining, when you do too much exercise and you need rest. And there's a similar word that I would employ, which is called overbraining. You've overbrained it. You've used your brain too much, and the brain needs a rest. And in some people, the brain reacts when it needs a rest by creating a migraine, a headache that is associated with difficulty seeing, with pain, with dizziness, with nausea, a sense of feeling sick, some light aversion, sensitivity to sound, irritability, wanting to stay away from people, feeling like there's a handbrake on your brain. And the stroke side of things comes in because often patients can experience tingling or numbness down one side of the body, flashing lights, even loss of vision, even heaviness of the arm or leg, which is much more associated with stroke, and understandably creates concern to that extent. But actually, when you're seen by a specialist, and when you're examined, and actually when we explore carefully what we call the biopsychosocial triggers of migraine, what's going on in your body, what's going on in your mind psychologically, and what you're doing socially. And just to break that down quickly, if you're a lady, then it may be related to periods or the pill. If you're taking too many painkillers or certain other medications or caffeine, that may be driving it. If you've got a lot on your mind, if there's a lot of eye strain going on or there's stress that you're dealing with, that's the psycho bit of the biopsychosocial. And the social bit of it might be alcohol, might be burning the candle at both ends, might be things like that. So using that biopsychosocial model alongside a clinical assessment, history taking, examination, and an MRI scan that we hope to deliver for you in the same day as part of the service that I offer, a rapid access neurology service. We get rid of that fear that you might have about having a brain tumor or stroke very quickly. Within 6 to 12 hours of seeing me, we can get a scan done usually, and then tell you what it is, and then give you some lifestyle biopsychosocial management to help alleviate your migraine. And we also have the ability to offer you some more advanced treatments, including magnesium infusions, which are given through the drip, which can help dampen down the migraine, reset the brain, reduce the overbraining. And we also have possibility of giving you injections, including of steroids or local anesthetic injections at the back of the head called greater occipital nerve blocks, as well as more advanced infusions and access to psychologists and migraine education packages. So we have a whole raft of treatments available to you alongside the diagnostic and clinical reassurance I can provide. And that's migraine for you.